Your heart is a truly remarkable organ, a muscular pump working tirelessly every second of your life. Think of it as the powerful engine at the center of your body's complex road network. It's about the size of your clenched fist and sits just left of the center of your chest, protected by your ribcage. This engine has 4 main chambers, 2 on the top called atria, and 2 on the bottom called ventricles. These chambers work together in a perfectly timed sequence, ensuring that blood flows in the right direction, delivering vital supplies to every part of your body, from the tips of your toes to the top of your head. The right side of your heart receives blood that has delivered its oxygen and sends it to the lungs to refuel. Once the blood is packed with fresh oxygen, it travels to the left side of the heart. From there, with a powerful squeeze, the left ventricle pushes this oxygen-rich blood out into the aorta, the body's main artery, to begin its journey, nourishing every single organ and tissue along the way. These are your blood vessels, a vast network of arteries, veins, and capillaries. The arteries are like major motorways carrying blood away from the heart, while veins are the roads that bring it back. To keep this engine running smoothly, the heart itself needs its own fuel supply from the coronary arteries that wrap around the outside of the heart muscle. This whole process is controlled by a natural pacemaker, a tiny cluster of cells that sends out electrical signals. These signals create the familiar lub-dub sound, the valves opening and closing with each pump. This rhythmic beat keeps circulation steady. It's an incredibly sophisticated system, worth understanding and protecting. So, what happens when this perfectly tuned engine starts to have problems? The most common form of heart disease begins quietly within the coronary arteries, the heart's own fuel lines. This process is called atherosclerosis. Imagine the smooth inner walls of these arteries getting damaged. Causes can include high blood pressure, smoking, and high blood sugar. When the walls are injured, your body repairs them, but that repair can lead to buildup. Fatty substances, cholesterol, and other waste products form plaque that narrows and stiffens arteries over years. Like sludge in a pipe, narrowed coronary arteries let less oxygen-rich blood reach the heart muscle. At first the heart compensates, but during exertion, climbing stairs or exercise, the muscle can become starved of oxygen, causing chest pain called angina. The bigger danger is when a plaque's surface ruptures. Your body forms a clot to seal the tear, like on a skin cut. In a narrowed artery, that clot can completely block flow, cutting off blood to part of the heart. This can happen suddenly in minutes. Deprived cells begin to die. That is a heart attack or myocardial infarction. The damage depends on the size of the blocked artery and how long the blockage lasts. Heart muscle cells don't regenerate. Areas of infarct are replaced by scar tissue that does not contract like healthy muscle. That weakens pumping ability and can lead to further complications like heart failure. Recognizing symptoms early and restoring blood flow quickly saves muscle and lives. Next, how a troubled heart sets off a chain reaction through the body. A heart weakened by disease can set off a chain reaction of serious health problems. One common result is heart failure. The heart becomes too weak to pump blood efficiently. Blood can back up into the lungs, causing fluid buildup and dangerous shortness of breath. If it backs up in the legs or abdomen, it causes swelling, edema. Atherosclerosis can affect arteries to the brain. If plaque or a clot travels there, it can cause an ischemic stroke. Consequences include problems with speech, movement, memory, and even paralysis. Scar tissue can disrupt electrical signals, causing fast, slow, or chaotic rhythms, atrial fibrillation being a common example. Quivering atria let blood pool and clots can form and then travel to the brain, increasing stroke risk. Severe disease can also cause sudden cardiac arrest, an electrical failure, different from a heart attack. Immediate CPR and defibrillation can restore rhythm and save lives. Without them, death can occur in minutes. These are the tragic outcomes of untreated heart disease, and why prevention and timely care matter. Next, how to mend and protect your heart. The good news is heart disease is not inevitable. There are powerful steps to treat conditions and lower your risk. For diagnosed patients, medications like statins, blood pressure drugs, and blood thinners are effective first-line treatments. If blockages are severe, angioplasty with balloon dilation and stent placement can reopen arteries. Very severe disease may need coronary artery bypass surgery, creating a detour around the blockage with a graft vessel. Prevention starts with lifestyle. Eat fruits, vegetables, whole grains, and lean proteins. Choose fish and olive oil over unhealthy fats and processed foods. Limit sugary drinks, processed snacks, and trans fats. Stay active, aim for at least 30 minutes most days. A brisk walk is fantastic. Manage stress with mindfulness, hobbies, and time in nature. Stress raises blood pressure. Combine lifestyle changes with regular medical checkups and medication adherence. Small daily actions add up. By choosing healthy habits and timely care, you can take firm control of your heart health and keep your engine running smoothly for many years to come.